Hello and welcome to Bristol Health Cares. I'm your host, Kurt Barwis. I am the president and CEO of Bristol Health. This program is for you. It's really about how you navigate the system of care, how you access care, and it's really about trying to answer questions you may have and really didn't know who to ask. We are going to bring to you professionals, doctors, surgeons, other healthcare professionals throughout our system of care, maybe people that you've never talked to before or met before, but the goal is to really help you understand how to access care when you need it. You're going to enjoy this program. This program is really for you. So what's important is if there is something that you want to learn about or know about or a guest that you'd like me to host on this show, write us and we'll try to make that happen for you. So enjoy the program, Bristol Health Cares. Hello and welcome to this episode of Bristol Health Cares. I am Kurt Barwis, your host. I'm the president and CEO of Bristol Health. Today, we have an exciting guest with us, Sabrina Trocchi. She is the president of Wheeler Health. New neighbor for us in Bristol, Connecticut. Welcome, Sabrina.
Thank you.
Tell us a little bit about yourself.
Thank you. Good morning, and thank you for having me here. Sabrina Trocchi, President, CEO of Wheeler Health. I've been with Wheeler for 10 years and now in the CEO role for 5 years. Just a little bit about Wheeler. We're a nonprofit organization that started in 1968. Behavioral health was really our focus. About 12 years ago, we decided we needed to do something differently for particularly our adult population, our adult behavioral health population, where we were seeing a very high percentage of our adults at that time in New Britain and in Hartford, close to 65 to 70% across those sites, who were reporting to us they did not have access to primary care. So 10 years ago, we opened up our first health center here in the city of Bristol. Yeah. And as you mentioned, we're new neighbors to Bristol Health. In July, we're very excited to open up our new site in 1 Hope Street in Bristol.
Yeah. So now your background, are you clinical? Tell me a little bit about that. How did you come to Wheeler Health?
Okay. I have a doctorate in public health with a concentration in behavioral health. I have a master's in public administration. And before joining Wheeler, I was with the State Department of Mental Health and Addiction Services. I served in a number of leadership roles, but in the last 6 years, I was chief of staff for the State Department of Mental Health and Addiction Services. In that role, I oversaw all of the state-operated mental health agencies across the state, in addition to providing oversight to all of the community-based providers.
Wow, now there's something, I don't know why we never talked about that before. I did not know that background. That's quite impressive. And you're using your education, like all of it. You have that public health doctorate and you've got the mental health focus, and that's quite extraordinary. So you've always been in this area in Connecticut, or you're from this region?
I born and raised in Hartford.
In Hartford, okay.
Lived in Hartford for most of my life, and then once I married, I moved to Cheshire, and I've been there ever since. Yeah,
that's really cool. So the range of services has kind of evolved, because I was part of. I think I actually wrote a support letter when you opened up the FQHC, and it's quite an extraordinary process to go through to be able to create an FQHC. And I was very much in favor and support of that in the Bristol community. And then once you were able to do that, you could actually then go to multiple locations, I think is the way I understand it. But it's a federal process.
It's a very lengthy federal process. So we established our first primary care here in Bristol, where we had one medical provider. That first year, we served 400 patients. Once we were able to demonstrate that we had a year of delivering primary care services, We then applied in a very lengthy federal process to receive the recognition. As soon as we received the recognition, we then started to look for other opportunities. So today we have 5 health centers.
It's awesome.
Hartford, New Britain, Plainville, Waterbury, and Bristol.
It's so, I think, one of the things that I'm trying to look at now in our data for our ER visits is to really be able to identify, how many of the individuals come in. As you talked about, the importance of having a primary care physician, having a routine physical as you go through life, and preventative care, so you don't end up in the most costly setting and environment. So it is absolutely so critical. You also have a very strong focus in pediatric behavioral health care. I mean, probably the largest in the state of Connecticut. Is that a fair statement? I mean, it's incredible, at least from my perspective. It feels that way.
So with the pediatric, I would say our pull has really been behavioral health. And so we are one of the largest pediatric behavioral health providers. As part of that, we've really started to look for the opportunities for integrated care. And integrated primary care, behavioral health is important across the entire lifespan. Because you need to understand, what's going on with your mind, with the body, and you need to understand how medications work together. And so having one integrated team working with pediatrics or adults is really our philosophy, our model, and we've been really successful with that.
Yeah, it's so interesting you say that. So we just moved to an integrated model, and our primary care physicians in Southington, and I met with the behavioral health team, and they were like thrilled because they were able to have the conversation about medications, about other medical issues and factors, and the patients loved it because they were coming to their primary care. They love it because they're coming to their primary care office, but they're also able to access those behavioral health services in the same place. So they're not going to a center where maybe people are looking at them, they think they're looking at them differently. They're actually going to their normal primary care. So that integrative approach, as you pointed out, the evidence behind that is just incredible. And we're also seeing that the increased need for more services as a consequence, which hopefully is helping our communities really become healthier and better. So you expanded to Hope Street, and what a great building. I mean, it's just incredible.
Thank you.
And the campus is really kind of filling out. And so what all is offered on Hope Street? Is it the whole range? I know your administrative services are there, right? You're located there.
Right. So in addition to our headquarters where we have quality, my office, our information technology, our human resources, and all other administrative departments, the first 2 floors are our health and wellness centers. So there we offer primary care, pediatrics, child psychiatry, adult psychiatry, behavioral health services across the lifespan, nutritional supports, chiropractic supports. We have a teaching kitchen on site, which is really exciting. So every Wednesday we partner with Holcomb Farms, where they deliver fresh fruits and vegetables, and we use those to demonstrate to patients how to cook healthy meals, and which is really exciting. And we do that for adults, and we do that for children, because it's really important to also work with children around healthy eating and preparing healthy foods.
It's funny you say that. It's one of the things that I've learned is, we primarily in this country teach nutrition in schools, but it's the family that actually impacts nutrition.
Right.
And so having a kitchen and having families come in and trying to educate and help the family develop a healthier cooking, buying of foods, fresh vegetables, and stuff like that. It's like, I think that's where the focus needs to be. Personally, that's where I think the focus needs to be. I mean, I think it's better spent doing what you're talking about than trying to educate a child on nutrition when they go home and it's not happening. So, so how does someone actually access your services? Like, talk to me a little bit about, and then the other thing
the fact that you are a federally qualified center, it also has really important implications to folks who possibly can't afford or don't have insurance. So please talk a little bit about that.
Okay. So as a federally qualified health center, we cannot deny care on the basis of an individual not having coverage or not having access to be able to pay for the coverage. So every patient who comes into our center, if they don't have either Medicaid, Medicare, or commercial coverage, we do a what's called a sliding fee scale. And we're able to gather information, and for individuals that have no documentation of working or ability to work, they are seen without any charge, and that's required as being a federally qualified health center.
Wow. So then, does the federal government then reimburse you for those services after you go through all that documentation? So there is a source.
The federal government does not reimburse us. So the federal government, once we became a federally qualified health center, we received what's called a base fund, a base grant.
Okay.
That base grant remains the same if you have one health center or if you, like Wheeler, now have 5 health centers plus 17 school-based health centers. So our growth has been pretty significant. So that that grant is considered a base grant, but really doesn't cover those services. As a federally qualified health center, we do have a different payment structure under the Medicaid program. So we're paid under a system called prospective payment system, which means we receive an enhanced all-inclusive rate for all patients being seen.
Okay. So the reimbursement, the way it works, it's not really important to the patients other than you're going to take care of them when they come through the door.
Correct.
You're going to figure that on the back end. But that model really does help those individuals. How about, and this is because I don't understand, undocumented individuals, people that,
we accept all patients. So
all
we
patients.
do not ask for any documentation regarding status of being a citizen within the United States. So.
And I think that's very helpful to understand because I think there is a lot of fear in that population that something's going to happen. If they go and have services, it might affect their status of being in the country. And obviously those individuals really do need health care. So pediatric, you have pediatric behavioral health, you have adult behavioral health as well. Okay, go ahead.
You mentioned, you asked, how do you get into care?
Yes, I'm sorry.
So for behavioral health services, child, adult, Monday through Friday from 9 to 3, it's a walk-in process.
Okay.
No appointment needed. Same day walk-in access is guaranteed. So we have triage teams that's all they do. They don't have caseloads. They are, they're in our centers, and they're open to see patients walking in. In the walk-in process, you're seen by a clinician, you're provided an assessment, and jointly the patient with the clinician come up with a treatment plan. Patient then is connected to other services as needed. So because we're an integrated care model, we ask questions around when was your last primary care visit? Do you need connection to other services and supports? We look for opportunities to engage in psychiatric services. And so patient, after that first session, leaves with a plan in place and knows when they're coming back and who they're seeing when they come back.
That's awesome. I didn't realize you had a walk-in program for behavioral health. So if somebody's in crisis, not sure what to do, they can come to your center.
They can come
and
in.
Be seen and walk out with a whole plan and direction.
Whole plan and direction, and the other area that we've really focused in on is medication assisted treatment. And so we have an open access model for medication assisted treatment. And that we know if an individual is presenting ready to access services for an opioid or an alcohol addiction, we know if we say to that patient, come back in 5 days, come back in 2 weeks, that patient, the likelihood of that patient presenting and coming back
Yeah.
is highly unlikely. So we've created our own workflows to ensure that if a patient presents and that's what they're looking to receive support on, that we work with that patient, and the goal is for the patient to leave same day with the medications, and then have a plan in place and know when they're coming back to us for ongoing care.
It's really a very, when I step back, kind of think about the totality of your responsiveness and your awareness of patient behaviors, you really fully have integrated that into your model, which is extraordinary. So patients coming back, there's a lot of different social determinants. You're sitting on a really good bus line. We have great bus service throughout the area, the region. So what do you see as the obstacles? Because, I feel like, when you look at the community with the access, and especially in Bristol, there's a lot of primary care, there's a lot of healthcare services. What are the obstacles and hurdles that
I would still put transportation as being one of the obstacles. And many of our patients come to us either with the Medicaid non-emergency transportation services, and that sometimes has limitations. So if a patient presents to us and we need that patient to receive lab work, we know if we provide that patient a script and ask them to present to a lab that's off-site, the likelihood of that patient presenting is probably diminished, right? So our goal really has been to try to bring all of those services on site. And one of the exciting partnerships we have in our new building is with Bristol Health, where we were able to partner with you folks, bring you on site, and provide the diagnostic lab work so that we can just say to patients, before you leave, you just walk in that door and they will see you right now. And that means that patient doesn't have to worry about taking 2 bus transfers to get to another lab, or to try to negotiate with their non-emergency transportation provider to say, I need to make another stop. And so it just really eliminates a lot of that. And that's what we try to do within the center, try to bring many of those services on site.
It's really a well thought out, well developed strategy, I think. And then having a new building, it seems like you've designed the building around how you're going to actually execute that strategy, which is brilliant. It's just, it's really awesome. So lots of expansion. And I remember before you was, working with Susan Walkema, and all this stuff was kind of on the drawing board, and all of it's become a reality, which is really extraordinary. Extraordinary for all of the communities you serve, not just the Bristol community. It's all very much needed services. And as you said, there were many communities where they had shortages of primary care physicians and things like that. So where do you see this going? Like what's next for you?
I continue to see some exciting growth. In 2017, we piloted a program with 4 Bristol schools where we had 2 full-time clinicians, and embedded the clinicians within the schools. And those clinicians started to see students during the school day, and we had a child outpatient clinic at the time. But what we were finding was when students were referred to us to come after school or during the evenings, maybe 50% of the students would present. When we were physically located in the schools, 98% of the referrals resulted in children getting access. Today, we are in all 14 Bristol schools, and we have about 28 full-time clinicians that are dedicated only to the schools. That's where they go every day. That's where they do all of their work. So when I think about where are we going next, while having a health center in the community, a visible health center in the community is amazing, we also recognize that not everyone will walk through those doors.
Right.
We still know there's a stigma associated with behavioral health. And we've really focused on making sure that our health centers don't feel like a traditional behavioral health clinic. We've integrated services so that anyone could be walking in. You don't know what they're walking in for.
Right.
They could be seeing the nutritionist. They could be working on diabetes compliance. They could be working on a number of different things. And so we're trying to work around that, but we know there's individuals that still will not walk through those doors. So how do we look for opportunities in the community to be able to engage individuals? And the school is one area that we've seen really good growth, and we're going to continue to look for more of those types of opportunities. Mobile health is another area. So we have one mobile van right now. We've acquired a second, and we're using the mobile health vans around Bristol, New Britain at this point to look to go to different shelters, different churches, different sites where we know individuals may not necessarily present directly to us. But let's do the outreach, let's engage, and let's see if we can get them in.
Wow, you're certainly focused on your mission, and that's really extraordinary. So I appreciate that. I'm curious, in the school program, does the referral come from? How does that referral happen? And because I like to think about it as the sensitivity of parents, and then the stigma of, the kids going, the stigma of them actually going to a counseling in the school. You've overcome all of that. So does a parent has to approve, or once they turn to the age of majority, I guess the kids can just voluntarily, like high schools, they can just go right in?
So we're in elementary all the way through to middle to high school. Referrals can come from anyone in the school. Teachers, guidance counselors, administrators. Anyone can refer a child. Once we receive a referral, we make a connection with the parent, the guardian, and we begin the discussion around consent. We invite individuals, parents, guardians to come in. We come up with a plan on how often we meet with their child, and then we come up with a plan, and it's individualized. Some parents want to meet with us individually. Some parents are comfortable meeting with us afterwards remotely and coming up with other ways to ensure that everyone's on the same page and everyone's aware of what's going on.
That's awesome.
And for as a mom with 3 kids, even though they're a little bit older now, just think about all of the juggling between sports and everything else that needs to happen after school. And for a parent or guardian not to have to take 2 or 3 hours off from work to pick up their child to bring them to a session and then go back to work. It's working. It's working. And,
I can see
we're
how
very
that
excited
would work.
about that. Yeah.
Sabrina, this has been like an incredible education for me, and I'm sure the viewing audience probably feels the same way. And so they can just walk in if they need to. You have services located beyond Bristol, lots of them. I think the important takeaway is if you have an issue, if you need help, you've got a behavioral issue or someone you're worried about affording primary care and things like that, what a great option, and what a great partner for Bristol Health in our community. So thank you very much.
Thank you.
I think we're going to have to continue on and do another segment with you because the energy and all the things you're doing, I think there's more to be delivered to the viewing audience. So
Thank you.
So thank you. Thank you all for joining us today for this episode of Bristol Health Cares. I am Kurt Barwis. You can write us at cares@bristolhospital.org. I am always very open to hearing from you about different topics, subjects, health-related things that you want to hear about. I want to thank Nutmeg TV. Nutmeg is a nonprofit organization. They need your community support to be able to do what they do. So please, please, please go on their website. There's a way to actually donate, contribute to their mission, their cause. Again, it wouldn't be possible without them, and they do such a tremendous job always. So thank you again for viewing today. I am Kurt Barwis. Until the next time, and please stay healthy. you.